let's begin with what I hope we can all agree upon. None of us want to see any Ohioan die unnecessarily from a virus. We all want a safe and healthy environment for our communities. All our lives, we've learned that medicines treat disease and vaccines prevent disease. When many Ohioans rolled up their sleeves to receive the vaccine, they did so under the premise that the vaccination would prevent them from contracting and transmitting COVID-19. I join you today from Delaware County, the most vaccinated county in the state of Ohio. Our hardworking health district has close to 80% of our eligible population vaccinated. That's those over 12. We should be the shining beacon on the hill for Ohio's pandemic response. Other county leaders should be coming to Delaware to see how a pandemic is crushed with the highest vaccination rate in not only the state, but the entire country. Despite this, we're still in the trenches with the rest of Ohio. Like every other county, we're red. We're considered to have a high level of spread. Our incredible health district developed its own innovative report card based on 5 critical factors to guide COVID-19 response based on the CDC's recommendations. As of our last report card, dated September 29th, Delaware failed every critical factor but one. Cases per 100,000, we failed. Positivity rate, we failed. ICU capacity, failed. Cases per 100,000 in schools, failed. The only metric we passed, our exceptional vaccination rate. As an elected official, I've had questions about how this could be, as I'm sure many of you would as well. I've spent hours with our health commissioner. I asked who is getting sick and who is being hospitalized. I learned while vaccinated individuals are faring better with hospitalizations and deaths, Delaware County is thankfully faring better than our neighboring counties. We are experiencing increasing numbers of breakthrough or fully vaccinated infections. Based upon the statistics that I requested and were published by our Delaware Public Health District on September 8th, between May and July, the fully vaccinated made up 21% of our cases, 41% of our hospitalizations, and 20% of our deaths. I heard vaccine efficacy numbers quoted yesterday in committee, and they were in the 90% range. I can assure you, the real-life numbers from the most vaccinated county in the state, unfortunately, don't match those efficacy numbers. What we're seeing in Delaware is not unique. On July 20th, the CDC published a report about an outbreak in Barnstable, Massachusetts. There was a large public gathering. 74% of the cases tied to this gathering were fully vaccinated. It was this investigation that caused the CDC to change their recommendations, requiring all persons, including the fully vaccinated, to wear masks indoors. The CDC changed this guidance because they had evidence the vaccinated were transmitting this virus. On August 6th, the CDC director said in an interview, "Our vaccines are working exceptionally well. They continue to work well with Delta. With regard to serious illness and death, they prevent it. But what they can't do anymore is prevent transmission." An investigation published on September 30th from a nosocomial outbreak in Israel substantiated the CDC's findings. In this publication, a fully vaccinated individual triggered an outbreak in a hospital, caused exposure to 248 people, 238 of them were fully vaccinated. All involved were wearing surgical masks, some were even in full hospital PPE. Of the 42 people infected, 38 were fully vaccinated. In this real-life scenario in a healthcare setting, a high level of vaccination and even surgical masks unfortunately did not prevent the virus from spreading, originating from a fully vaccinated individual. Regarding the observed results from this study, the authors state, "It challenges the assumption that high universal vaccination rates will lead to herd immunity and prevent COVID-19 outbreaks. This was probably true for the wild-type SARS-CoV-2 virus, but in the outbreak described here, 96.2% of the exposed population was vaccinated. It's clear in Ohio's data, the vaccine provides a level of protection against serious illness and death in the recipient. We don't mandate medical treatments to protect individuals from themselves, however. If we did, we'd have BMI mandates, required daily exercise mandates. The very justification of a vaccination mandate is to prevent transmission of a disease to others. We don't want unvaccinated nurses putting patients at risk or unvaccinated employees putting other employees at risk. That part's never made sense to me, honestly, though, because I thought the vaccine provided that protection. Regardless, I've heard it discussed repeatedly that a business owner has the right to establish a safe and healthy environment without government interference. But if both the vaccinated and the unvaccinated can transmit the virus, according to the CDC and numerous scientific investigations, how does a business owner or healthcare facility's vaccine mandate stop transmission? Quite simply, it doesn't. And since it doesn't stop transmission, a mandate unfairly applies consequences only to the unvaccinated for a virus that both are capable of transmitting. We know spread has occurred on fully vaccinated cruise ships. I have observed vaccinated spread in the district I represent. Ohio Wesleyan University was one of the first universities to institute a vaccine mandate. Nearly all students and staff were vaccinated. We would have expected spread to be non-existent, especially nestled within the most vaccinated county in the state. Yet, there were nearly 3 times as many cases reported in the first 3 weeks of school than in the entire 14-week spring semester when there was no mandate available to students. These cases occurred in both the vaccinated and the unvaccinated. The mandate didn't stop the spread, but I could tell you story after story of the young lives that were forced to walk away from $100,000 scholarships, with college plans devastated because of this mandate. The CDC is abundantly clear on this. A vaccine won't stop transmission. Scientifically, it's been well established. Both the unvaccinated and the vaccinated are spreading the virus with similar viral loads. A vaccine mandate is therefore built on a false premise that a mandate will ensure a safe environment. Solid legislation should not be built on a false premise. To talk about what types of mandates are appropriate, when they should go into effect, what types of exemptions should be permissible. Wouldn't science first have to agree this mandate would do what it's intended to do? And if a mandate won't guarantee transmission of the virus won't occur in the workplace or the ICU, the only possible reason to issue a mandate is to impose one's will upon another and to be punitive to those not vaccinated, thereby creating a system where discrimination is not just permitted, but sanctioned. It's this very scenario when citizens need their government to intervene. The U.S. Chamber of Commerce fought the Americans with Disabilities Act. They lobbied against it, calling it the heavy hand of government. But today, individuals with disabilities have access to public places because elected officials passed legislation to protect them, even though they were a small minority. There isn't a single place on earth that has successfully conquered this virus through high vaccination rates, mandates, or forced compliance, but there are several places that have gone too far trying. We need legislation that prevents vaccine mandates from being issued. No Ohioan should have to ask their employer for an exemption from a vaccine that science has shown does not stop transmission. Employers need to first justify with some science that high levels of vaccine compliance have stopped the spread somewhere, anywhere. It unfortunately hasn't. Sub-House Bill 435 and the protections in this bill apply only to current employees, but not those employed after the bill's effective date. Nothing about this virus as it relates to workplace safety is likely to change once this bill takes effect. My biggest concern with the bill is it codifies an employer's ability to issue vaccine mandates without any justification at all. While it does provide exemptions, several are complicated and unnecessarily narrow. The medical exemption, for example, requires a primary care doctor. What if one's cardiologist doesn't recommend vaccination? One of the exemptions acknowledges natural immunity, but there's no scientific standard. It requires an unvaccinated individual's antibodies to be measured at the same level as a vaccinated individual. Is that a vaccinated individual 1 month after vaccination? 4 months after vaccination? When does this protection wane in vaccinated individuals? Is it different for each individual? Does age play a role? This is very complicated and full of potential unintended consequences. To simplify these complications, please consider this bill's exemption for reasons of conscience. This is essentially any reason. It's the same thing as saying vaccination decisions should be left up to the individual. This committee could simplify 34 pages of legislation, complicated exemption language, grandfather and sunset clauses, and simply say this on page 1. Since COVID-19 vaccines do not prevent transmission, individuals should make their own COVID-19 vaccination decisions with their healthcare provider, free from mandate, coercion, or discrimination, and should not be barred from employment opportunity or access to public accommodation based on vaccination status. Please respectfully consider substantially amending this bill to prevent discriminatory COVID mandates from occurring.